Welcome to BW Healthcare World. Today, our special guest is Professor Arvind Kumar, who's the Chairman, Institute of Chest Surgery, Chest Onco Surgery, and Lung Transplantation at Medanta. He specializes in the treatment of surgical diseases of the chest, which involve the lungs, pleura, mediastinum, trachea, which is the windpipe, esophagus, which is the food pipe, chest wall, diaphragm, including chest trauma. Dr. Arvind Kumar, thank you so much for joining us on BW Healthcare World. You have been talking a lot about the growing incidence and trends on the lung cancer in India. What has been your observation because of which this has suddenly come to the limelight? Are the statistics in India very different from what we see in the world? And what are the statistics?
Okay. First of all, Mr. Narula, thank you very much for involving me in this very, very prestigious program. I'm grateful to you and Business World for this opportunity because it allows me to talk about a topic which is very close to my heart and has tremendous public health importance for the coming decade or two for our country. So you put this question that why have I been talking about this issue of lung cancer, etc., etc. So I'm a chest surgeon and I have been operating on lung cancer cases for now over 30 years. I started my career at All India Institute of Medical Sciences in 1988. So when I looked at the profile of my cases, the number of my cases and the details of my cases way back in 1988, and when I first looked at this data 30 years down the line in 2018, there was a massive demographic shift which I noticed. Initially, I thought that maybe there is some aberration, but then I cross-checked that with other people from across the country, and I found that that aberration was actually not an aberration. It was ground reality. And what is this? First of all, the incidence of lung cancer cases is rising rapidly. Now, how do I say that? So there is an organization which puts out incident statistics, and it comes in the form of data from national cancer registries as well as international organizations. And the other thing is our own cases that we see in the OPD. Now, coming first to the registries, when you look at the registries in various cities about incidence of lung cancer in men as well as women, you find that the lung cancer from a very low down position 20-30 years back today has become the #1 cancer in terms of incidence in men, and in women from a very low down position, it has galloped to 3rd position in women. So there is data, hard data from cancer registries as well as various international organizations to prove that the lung cancer in terms of incidence is galloping to #1 position in men and #3 position in women. And in women, it is increasing rapidly. So the day is not far where it may become #1 in them also. That's the hard data. Now, coming to our OPD attendance, suppose I see 30 patients in an OPD. 1988, I would see maybe one lung cancer case in a couple of days. Now, that was where we started. And these days, when I run my OPD at Medanta, if I see 30 patients, there will be at least 6 to 7 cancer patients I'm seeing every day as an individual. Now, I'm a specialist, so you might say that there may be some referral bias, but even taking care of the referral bias, there is an increase in the number of cases. So our personal experience in the OPD and hard data from cancer registry shows that the incidence is rising. This is information #1. When we look at the profile of these cases, 90% of these patients were smokers way back in 1988. Current data shows this distribution to be 50-50. So there is a rise in lung cancer cases amongst so-called non-smokers. And why do I use the word so-called? Because I believe that there is no true non-smoker in India. By virtue of breathing 25,000 times per day, inhaling 10,000 liters of toxic polluted air every day. Each one of us in India is a smoker. Somebody may be an apparent cigarette smoker, and we all are maybe inapparent air pollution smokers, but everybody is a smoker. But data shows 50-50 distribution. That's very startling statistics, number two. Number three, when I looked at the age profile, in Western countries, it occurs mostly in 60s and 70s, which was the case with us also 30 years back. But now 20% of my cases are under 50, 10% are under 40, and I have 2.6% cases under 30. Can you imagine a 26-year-old boy or girl, non-smoker, developing lung cancer? I've operated 2 in the last 2 weeks, such cases. So a downward shifting of the affected age. That's starting fact number 3. Number 4, when I looked at the number of women, it was very few women in the data earlier, and now 30% of our cases, 1/3 cases are women. Number 5, when we looked at the stage at presentation, we found that 80% of these cases are presenting in late stage, where their disease has already spread and cure is not possible. We only talk of controlling the disease, but the cure is talked about only in 20% of the patient. And lastly, when we looked at these people as to why they came late, we were astonished to find that many of them had presented to doctors in time, but they were misdiagnosed. About 30% of the total cases that we had were misdiagnosed as tuberculosis and were treated for 3 to 5 months with TB medicines before they moved to another doctor and were diagnosed as lung cancer. And there is a reason for that. And the reason is that both present with persistent cough and blood in the cough. Now that is a symptom of tuberculosis of lung, and that same symptom is tuberculosis of the cancer of the lung. Now tuberculosis of the lung is very common. Every doctor, every person in the country knows that if you're coughing out blood, this is tuberculosis. But lung cancer awareness is abysmally low. So when lung cancer presents to the community doctor, it's presumed to be tuberculosis. So everything which presents with cough and blood in the cough is tuberculosis. So that's leading to a lot of misdiagnosis and therefore patients reaching late stage despite being with the doctor. So these were 6 startling findings. Now, what does it lead to for the next 10 years? More and more lung cancer cases, more and more cases in non-smokers, more and more cases in women, more and more cases at younger age group, and more cases presenting in advanced stage. Now, when you juxtapose this very frightening scenario of massive increase and downward shift and ladies' involvement of this kid and juxtapose it against the facilities available, you look at the nation as a whole, you find there are very few specialized centers available. And it's a known fact that when you have advanced cancer and a specialized cancer like lung cancer, the outcomes of treatment at a specialized center are far better than outcomes of treatment at a general center. So more and more cases who will be dealt with by non-specialists ultimately will lead to poor outcomes. So there is a huge public health significance of this finding that we have.
It's how you beautifully articulated that, how we are sitting on a challenge which could even become startling and difficult to manage in times to come. So something needs to be done
now.
So
Mr. Narula, I have used the word imminent lung cancer epidemic.
Yes.
For this. In the study, we said that we are actually facing an imminent lung cancer epidemic across the country in the coming decade.
Absolutely. But sir, when we are looking at the number of cases increasing, something that also comes to my mind is that there are more number of, I don't deny the fact that pollution is one of the very big major causes of why the lung cancer is happening. But in the non-smokers, could there be some other reasons which are also contributing towards the rise of lung cancer? Or is it just that also we have more and more people getting screened for healthcare today than ever before?
Sure, sure. I think you hit the nail at the right place. So smoking is known to be a known cause of lung cancer. Now we know that when we look at the smoke chemical analysis, cigarette smoke, you find there are about 60 to 70 cancer causing chemicals there, which are known carcinogens. When you look at the content of a toxic air with lot of smoke, you find that all those chemicals are present here also. And that's why Director General WHO has called air pollution as second tobacco epidemic, because in terms of damage to the lungs, it's having the same effect because the cancer causing agents are the same. So there is smoking still present, and I see actually a real increase in the incidence of smoking in youngsters. You know, because I do a lot of programs in schools, and when I go and interact, I find a lot of them actually taking to smoking. So whatever the data shows, but I think on the ground, the smoking continues to be there. On top of that, now pollution is getting added. And Mr. Narula, there is a major difference between smoking and pollution impacting us. Smoking usually is started in late teens. So your exposure to cancer agents starts around 18 years of age. And we know that takes about 25 years for the agents to cause cancer. So you are getting the cancer at about 50. Exposure to pollution starts at birth. In Delhi today, if the AQI is 300 plus, if the PM 2.5 is, let's say, 300, it's equal to nearly 15 to 20 cigarettes in terms of damage to the body. So a child born in New Delhi today would start smoking 15 to 20 cigarettes from the first breath of his or her life. And this will be present 24/7 for the rest of the life, as long as he continues to breathe this air. This is the major difference, Mr. Narula, between smoking and air pollution. Smoking starts later, is present in few people. Air pollution impacts every citizen breathing, and none of us can stop breathing.
And which is probably why we see the incidence
Which
of
is
lung
the
cancer
reason
at a
why
younger
we
age.
are seeing a massive increase in the number of asthma cases, increase in the number of pneumonia cases in children, COPD cases in adults, and which is why we are seeing such a massive rise in the number of lung cancer cases. And you, of course, put it rightly that there is an increased awareness also. People are getting more and more CT scans done. So there is a awareness angle also. But I think causation angle is much, much bigger than the awareness angle.
Absolutely. Now there are two things that need to be done. One is working on managing the pollution, and I think that is a need of the hour, but it needs to be done at a much larger level, beyond the government, beyond the specialist, by every citizen who needs to become conscious about doing this. Now the other aspect is smoking, where there's a lot of awareness which has been created by media, by institutions, by medical people, by advertising industry, by putting those signs on the cigarette box. But you also mentioned something which gets my attention, that a lot of women have taken to smoking, which was something which was not culturally accepted a few decades ago. Now, if you go out on the street, you find young girls smoking. Now, what I want to understand is, since when we create awareness of non-smoking among men, we are talking of, we showing ghastly pictures of oral cancer and the effects of oral cancer. What are the effects of smoking that women may face? Because physiologically we are different in the short term and in the long term, which should be brought to light in terms of creating awareness specifically for women smokers.
So this question can be answered in a very short sentence, that physiologically we may be slightly different, men and women, but in terms of impact of smoking and air pollution, It's exactly the same. So if a man smokes 20 cigarettes a day for 20 years and gets lung cancer, so if a woman smokes 20 cigarettes a day for 20 years, her chances of getting lung cancer are as much as the chances of a man getting it. One. Two, if a lady is inhaling polluted air, the impact of that on her lungs will be the same as the impact of polluted air on the lungs of a man. So in terms of health impacts of air pollution, as well as health impacts of cigarette smoking, men and women are not different.
But sir, does it in any way affect reproduction, uh,
Yes, yes,
pregnancy?
yes. Mr. Narula, very good question. And this has brought me to mentioning that the most frightening information which has come in the last 5 years is that air pollution does not wait for us to be born. It starts hurting and hitting us even before we are born. So when a pregnant lady breathes in a toxic air environment, the toxins go to her lung, they get absorbed into the blood, and through the blood, they cross the placenta and hurt the child who's there in her uterus. So if it's first trimester when the organs are being made, it may cause congenital defects. And in the second and third trimester, it causes growth retardation, intrauterine death, premature birth, premature delivery, perinatal deaths, and whole lot of problems. It's a known fact that it starts hitting us before birth. And when the child comes out, from the very first breath, they start having the damage. And that's why if you talk to pediatricians, they will tell you that these days their OPDs are flooded with children, neonates, infants, and everybody has only one problem, breathing difficulty, and everybody is being given only one treatment, bronchodilators, nebulizer, nebulizer. Nebulizer is an ubiquitous machine these days. Every house which has a mixie and a washing machine also has a nebulizer. It's a very sad scenario. So the impact is there, and impact is hurting. And it's not just lungs. A lot of people have this misconception that air pollution hurts our lungs only. No, lungs are the portal of entry. They take the brunt of the attack, but from the lungs, these chemicals get absorbed. They go to the blood and they impact every organ from brain to toe. So you have brain suffering neuroinflammation in children, which is now linked to hyperexcitability and attention deficit problems, which a lot of schools are reporting. In the long run, it has been shown to impact the IQ development. And in fact, they have said that children in polluted cities may be losing their IQ by 10 because of the breathing polluted air and the impact on the brain. Number one, it's been linked to premature hypertension. So a lot of schools now are reporting hypertension in teenagers. And that again is being linked to pollution. Even diabetes, which is increasing rapidly in India. India is now diabetes capital of the world. Now there is data to show that the pollutants go and cause inflammation in the pancreas, and they may be contributing. Obesity. Up till now, we thought that obesity is because of what you eat. But now there is data to show that it may be because of what you eat, but it is also because of what you breathe. So these pollutants go to the fat, alter the fat metabolism, and they tend to gain weight. I represent an organization called Lung Care Foundation. We did a study of 1,100 school kids 2 years back in two leading schools in Delhi and studied the lung health of 11 to 14-year age group children. We took their questionnaires, did the examination, and did an on-site lung function analysis. And we were astonished to find 37% of the boys and 19% of the girls. Overall, 28% children had spirometry proved asthma. So 1 out of 3 children in Delhi have asthma. 95% of them were not even aware of it, although they all were complaining of persistent cough and running nose and sneezing for a long time, which was some suggestive symptom, but it was not diagnosed. So there is a huge amount of damage that is occurring. When it comes to reproductive system, again, there is data to show that it actually impacts in a negative way. So the production potential may be less. So there are cases of infertility which could be somewhere related to the exposure to air pollution, both in men and women. So decrease in semen count, problems there, decrease in problems in ovulation and all. So there are reproduction related issues. Bone metabolism is affected. All other organs are affected. In the adults, 10 times increase in the heart attack rates, 10 times increase in the brain attack rates. These are all WHO statistics. So if you look at overall, there is a huge amount of disease, there is a huge amount of disability, huge amount of absenteeism from work, because when the person is sick, the family also has to take leave and take care of that person. And finally, millions of premature deaths as proved by WHO data. And if you look at economic impact, because people say, oh, no, it's okay. It's just in terms of number. There is a huge amount of economic impact. So I say that if we take care of air pollution, we will save millions of lives. We will save trillions of rupees, and we will save our future generation from the ravages of climate crisis, because air pollution and climate crisis are two sides of the same coin.
Right. So, Dr. Kumar, what also now comes to our mind, since you mentioned asthma as a huge growing problem because of pollution. Now we had asthma patients as such, people who are, they have this condition, and this used to be a certain part of the year, certain seasons where there was pollination, and they would be taking extra cautious control over themselves and what their actions and in their life were. But now, what about asthma patients who are now also living in a polluted world?
Yeah.
What is it that they need to do to ensure their own safety? Because I've seen people succumbing to asthma in situations.
So in this context, first of all, I want to make one very relevant statement that air pollution, unfortunately, despite causing lot of disability, disease, and death, had never been directly implicated as a cause of death in any of these situations, because it causes indirect death. So, you have asthma, your asthma gets worse because of air pollution, you finally die of that. So cause of death, asthma aggravation. You have a heart attack because of exposure to air pollution. What do you die of? Heart attack. You have lung cancer, which is because of air pollution. What do you die of? Lung cancer. So for the first time in the world, a historic case happened in London, where a child, 9-year-old child, Emily was her name. She had asthma aggravation and finally died of that. Her mother went to the court and proved that her asthma aggravation and finally death was because of exposure to air pollution. And the court ordered that air pollution should be mentioned as a cause of death in her death summary. So that's the only case in the world where air pollution is mentioned as a cause of death. I think we need to do that in our system also. Whether brain attacks, whether heart attacks, whether pneumonias, whether lung cancers, tuberculosis, all these diseases are getting aggravated because of the air pollution. And we need to bring that factor that air pollution is adding. Your question about asthma, I personally know dozens and dozens of people who have moved out of Delhi because their asthma was grossly out of control. They were on steroids, they were on inhalers, and they had no choice but to move out. And the moment they moved out, things came under control. And it's a known fact that when this October, November, December, January pollution season comes, when the pollution is at its worst, all these patients need to increase their frequency of inhalers. Sometimes they need to add steroids. Sometimes they need to be on higher medications. And many of them need admissions during this period. It's a proved fact. It's not my figment of imagination. Any hospital, any doctor will certify to this outcome.
So, Dr. Arvind Kumar, you mentioned about, or you shared us the story of Emily. and how the cause of death was air pollution that was mentioned. Have the governments in other countries learned from this? Do you think there are initiatives being taken by government agencies, and are these initiatives enough? What are the loopholes? What needs to happen?
Mr. Narula, we are treading slightly on a political kind of arena. So I usually restrain myself to medical issues, but I'll answer this question. So I was recently at COP27 in Egypt, and I heard about the statements made by heads of states and representatives of governments from across the world. So if you look at the commitments which are being made there, which were made in COP26 as well as COP27, I think we should be solving this problem in a much faster manner. But when you look at the commitments which were made in 26 and see whether they were actually implemented on the ground in letter and spirit, the answer comes no. So there is a pressure on governments across the world, from civil society, from medical organizations, WHO particularly, that it's not a chemical issue. Health is in the center of air pollution and climate crisis. Air pollution and climate crisis is about existence of human beings as a race. Because if we don't control it, if we let it go uncontrolled, our very existence will be at stake. This is the level to which things have reached. And recent floods in Pakistan, recent floods in India, massive landslides across Uttarakhand and Himachal, all this that we note, the jungle fires in Australia, in California, various tornadoes and tsunamis across the world. If you look at the incidence of these natural disasters in the last 5 years and compare it with the incidents, say 25, 30 years back, you would notice a huge increase in the incidence. And it's all direct impact of climate crisis now. It's there. It's not something we are going to see 10 years later. It's there. We are already facing the consequences. And therefore, it's a health issue, because there is predictions that lot of diseases which have disappeared will come back if we don't control all this crisis. So it's a major health issue. The governments are aware. Solutions also, we know there is a desire to implement those solutions, but there are some issues which need to be addressed. But my take on it as a doctor is, whatever the price to pay, there is nothing which is more precious than life. So anything, just the way when COVID crisis came, the whole world came to a grinding halt to stop that virus. Same kind of response, Mr. Narula, is needed today from governments across the world for this problem, because this problem is killing more than what COVID killed. The only difference was COVID killed directly in a short time. This kills indirectly over a period of time. So perceived impact is less, but the true impact is much more.
No, I think, I completely resonate when you say that, this has to be considered as a health issue and not anything else. Because, and I think I'm so glad that somebody like you has taken this upon himself to fight for this cause. Because, somewhere when we are looking at the medical system, we are talking of, like you said, the direct cause of death, but nobody is going deeper into as to why this condition actually happened. So I think we, as a medical fraternity, need to start bringing this to light. Okay, why did you get heart problem? Beyond your food and beyond your exercise, there's something else which you have not been able to control. Sure. So I'm so glad that we brought this up. Now, I also want to get back to the medical side of it. I want to understand that, like you said, people are using inhalers, people are using nebulization. Is the prolonged usage of inhalers and nebulization safe for the lung related ailments? What are the issues that could be there, or are there any risks over a period of time?
See, every medicine that we take is a chemical, and every chemical has some positive effects and some negative. There is no medicine in the world which is without side effects, right? And side effects could be related to the amount of medicine you take and the duration for which you take that medicine. So whether you're taking inhalers, nebulizers, steroids, or other medicines, each one of them has side effect. And secondly, what I say is that these are not solutions. So if we say that, okay, government is going to give free nebulizers to the whole population, let the air pollution problem go worse, let everybody get asthma, but we are going to give nebulizers to the whole country. That's not a solution. So the solution is to not let people fall sick. And when we know that air pollution is leading to asthma, the least we can do is to control air pollution. I also want to mention in the same sentence that a lot of people talk of preventive measures post pollution. Doctor, pollution is there, but then how can we protect ourselves? Personal solution people are looking for. Air pollution is a community crisis, and people are trying to look for personal solutions in this community crisis. Unfortunately, this approach was taken for water. This approach was taken for electricity. So when we had water not being pure in our taps, we, instead of fixing that problem, we shifted to water bottles. Personal solution to a public problem. When the electricity supply was not good, it was erratic, we shifted to what is that called, generators and inverters. Again, a personal solution to a public crisis. Now, when air is bad, people are saying, okay, let's put masks, let's buy air purifiers, attempt at personal solutions to a community problem. Unfortunately, air pollution and the other two things are vastly different. You can be without water for 5 to 7 days. You can be without electricity for n number of days of your life, but you cannot be without air for more than 1.5 to 2 minutes. If that was possible, we wouldn't have lost any dead person in Bhopal. Despite knowing that there is poison in the air, they breathed and they died. Can you carry an air purifier 24/7 around you so that you are protected 24/7? We are breathing 24/7. You buy, Mr. Narula, most expensive air purifier, you put it in your office, but maybe 6 to 8 hours it will help you. What about the time you're going to market? What about the time you're going to other places? Can the whole population be kept confined and arrested within the rooms protected by air purifiers? Can you air purify the playing grounds in schools across the country so that our children can play happily and peacefully? No. So this is where, these smoke towers, air purifiers, masks, these are all cosmetic solutions. Air pollution is a problem which can only be solved in one way. Find the source of pollution, fix it, prevent the air from being polluted. You let the air be polluted and think of measures to clean it. Well, no country in the world has solved air pollution by this method. It will not work because air knows no boundaries. It knows no district boundary, state boundary, no national boundary. So the air at Wagah border will not say that, okay, this is Indian side of the air and this is Pakistan side of the air. Either side, if it's dirty, it will go to the other side. So solving it at source is the only solution.
So my last question to you in this segment is, can you highlight more about the rising COPD challenge in the country?
Yes. So COPD again has multiple causes, and smoking and now air pollution is also one of the important causes for this. And what happens is that these chemicals, they go and they damage the lungs. So we have this air trapping which happens in the lung. There is damage to the lining, to the walls of the what we call bronchioles and bronchi and the alveoli. So these kind of develop swelling inside. They become constricted. Now that swelling and constriction comes in asthma also. But the difference between asthma and COPD is in asthma, it's reversible. You give bronchodilator, it gets reversed. But in COPD, you have permanent kind of an obstruction, which leads to air trapping. And therefore, the chest of these people, what we call barrel chest, it becomes bloated. The diaphragm goes down and the lungs are kind of like overinflated balloons they become. And that hampers the oxygenation. So these people, they have decreased exercise ability. They become breathless very soon. Ultimately, they go on oxygen. And these diseased lungs are very prone to secondary infections. So they keep getting frequent attacks of infections, pneumonia, and ultimately they succumb to that. And it's one of the important causes of mortality worldwide these days, and is sadly rising in incidence in India in both urban and rural areas, as reported by, again, hard data. In urban areas, it is smoking and ambient air pollution. And in rural areas, it is smoking and household air pollution because of the use of solid fuel inside the house, which is leading to this increase in the numbers.
Dr. Arvind Kumar, thank you so much for joining us today. It has been such a fruitful conversation. And I think, we have built the cat to raise our eyebrows onto something which is, I don't know if we are going to solve for us, but I think we all have a responsibility to solve for our children so that they can survive, if I can say so. And you very beautifully brought out two elements, that air pollution is the second tobacco epidemic we need to solve. The child is born and smoking 15 cigarettes a day. So you can imagine what we are giving our children of today. And second is, what was very beautifully articulated is, because I had this question which I did not ask you, because you gave me an answer that the personal solution is not the right thing for a public problem. I think with that, I must thank you for taking our time and sharing your thoughts that can help people trigger something that they need to do, because it's only going to be solvable when each one of us is going to start working on it. So thank you so much for your time, sir.
It's been a pleasure interacting with you, Mr. Narula. Thank you so much.